There we go. That worked. All right, so thank you everyone for attending today's webinar and signing up. Just so you know, this webinar is part of our larger Healthy Utah Communities Learning Network. As part of that learning network, we do try to put on webinars about once every 2 months, just addressing different topics about how to build a healthy community. So we're really excited today to be able to speak about the topic of communities and healthy aging. As we know, about 1 out of every 10 Utahns is 65 years or older. And in the next coming decades, that number is expected to double to 1 out of 5. So this is a big topic, one that all of us will probably be facing in our own individual work. So before we get started, I do just want to let everyone know that, like I said, we are recording this webinar and we will send out the recording link afterwards in the follow-up email that will also include the slide deck used and the resources like websites talked about here today. We also do post these webinars on the Get Healthy Utah website. So if you are interested in going back and watching some of our past webinars, you can always do that. And I'll be dropping the link in the chat shortly so that you know where to access those. I do also want to mention that we do have a lot of participants, so just as a reminder, if you can please make sure that you stay on mute throughout the duration of the webinar, that would be helpful, and if we have time at the end, we will open it up to Q&A. Also, please feel welcome to drop questions in the chat, and if our speakers have the opportunity to address those, we'll also make sure that they see those. So with that, we will go ahead and get started. We do have 2 speakers today. The first one is going to be Darren Hotton from AARP, who helps manage the age-friendly community.
She's still there? Did she go away? We can get started, I guess. There we go.
That and earn that designation. So I'll go ahead and read their bios just briefly, and then we'll turn it over to Darren once I'm done. Darren Hotton is the Outreach Director for in healthcare and community programs. He specializes in helping organizations and local leaders navigate complex systems and build strong partnerships that improve health and quality of life. At AARP, Darren focuses on sharing practical tools and strategies like the age-friendly designation that help cities and towns create communities where residents of all ages can thrive. Ryan Anderson is the Municipal Services and Planning Program Manager for Salt Lake County, where she helps guide strategic planning, regional initiatives, and public engagement efforts. In her role, she works closely with community partners, local governments, and state leaders to promote policies that strengthen cities and towns. Ryan played a key role in helping Salt Lake County earn the age-friendly designation, bringing together stakeholders and residents to create a more livable community for people of all ages. All right, well, thank you to our speakers. And with that, Darren, you can go ahead and take it away.
Thank you very much. And thank you for Ryan for being here to go through the experience of joining the Age-Friendly Network. As I show the screen now, here's the presentation. Like they mentioned, that the presentation will be available afterwards along with the recording. And if you have questions, we hope we can answer them, but hopefully you'll also be entertained. So the Age-Friendly Network is with AARP is put in place because, as we know, people like to age with dignity and with their information or their ideals in mind. And so just a basic graph here shows the aging in America, the population of age 65 plus between 2015 and 2030. So as you can see, it's getting to be pretty high percentage populations. And so people want to stay in their homes. So as you can see from this presentation here, this slide, 2/3 of all adults and 79% of those are 50 plus. They want to stay in their current communities. Reason why is people love their communities. That's why they're there. They were there in the first place. They moved there. They love it. They want to stay there. But when they look at these communities, they want good health. They want proper street safety and good opportunities to engage and interact. So they call them their forever homes. And as part of AARP's Age-Friendly Network, we want them to have their forever homes. So a question for you guys as you're with this presentation, what is the first thing that comes to mind when you hear the term age-friendly? Now, that's probably a lot of different explanations or different terms in your mind. AARP doesn't focus on one particular description, but in general, it focuses on lots of different things. So as we go through this presentation, think about what you would like it, what you would consider an age-friendly community, a county or a state, or even just a city. So our definition is where a community elected leadership has made a commitment to actively work with residents and local advocates to make their town, city, county an age-friendly place to live through the enrollment in this AARP network of age-friendly states and community. We have a copy of the application here on the side. And what this is a process where communities come together, cities and counties come together and they commit to a 5-year process to improve something within their community. What happens is you enroll in the community, you do a needs assessment, you develop an action plan, you implement that action plan and track progress, and then you evaluate the impact of work and create a progress report and do it all over again. These are something that, as we go through the different steps are involved, you don't have to do this on your own. You don't have to make up all these things or start from scratch. We have lots of different communities that have already gone through this before and have experience, like Ryan's going to help here in just a few minutes. But as you go through this, we just wanted to show you a map of what's currently happening. As of this month, there are 14 states and 990 communities that are currently enrolled. So we want to put a strong push. Maybe if you start this and you want to do this in your community, you could possibly be number 1,000, which would be a big number. So just think of that. You could be on the map and you can have the 1,000th community in there if that's your community and you want to start this process. But we strongly encourage you to look at this and how it works and the process and the steps involved. It's not difficult, but it shows your community how important it is for people to be in their forever home. So what are some of the benefits? You can read through for the network and for the community. Some of the things I like about it is that it fosters partnerships among community groups and local stakeholders as part of that membership. But with the community itself, it provides help for local leaders to identify and understand those community needs. And in 2022, they did a survey about the impact of joining. And some of the things that they came out with is 68% advocated for policy change, which means that they had successfully advocated for their change in their city or their municipality or their organizational policies to help with those forever homes or those age-friendly communities. And 86% were overcome barriers to age-friendly change. The main thing with this is the importance of having leadership buy into this process because if they see the importance of having age-friendly communities, it changes the framework, it changes the whole process within that city or town or community or county, and it helps them. So if you're helping with street safety, you're not only providing that street safety for an older adult in their 70s to walk around town, you're also providing safety for that 8-year-old who's on their bike and they're in town too bicycling around. So it's not just an older adult aspect, it deals with everybody in the community because an age-friendly community affects everybody, even including the younger generations, as we mostly think of people with older adults. So we talk about age-friendly, and these are the 8 domains of livability. As you can see here, it's a circle with lots of different things. I'm going to cover each of these in separate. But when you start the process of becoming an age-friendly community, you don't have to do all 8 aspects of this. You can do 1 or 2, or you could do all 8. It depends upon how your community is and the leadership and things that they'd like to address first. Now, remember, this is a 5-year process where you could work on one and two and then come back the next 5 years and work on two or three more. It's just a continual process to make your community better. And not only is that a win-win for the people who live within the community, it's also a win-win for the leadership and the elected officials of that community because it shows that you're there and you're willing to help. So here is the 8 domains again, listed out into specific things: spacing, transportation, employment, communication, respect, social inclusion, social participation, and housing. So the first one, outdoor spaces. People need places to gather. And these green spaces, seating, accessibility is one of the domains that we have. As part of these age-friendly communities, we have resources to help leaders plan through and do community needs assessment and help with these plans to put them in place to help with things. So nearly 3/4 of adults say it's important to have a safe, well-lit park and gives residents a place to gather and interact with friends. Um, we know it's getting cold here, so the park usage is going to go down, but over the United States, the importance of having proper lighting and proper places to sit while they're in the park is a great thing to add to help with the older adults and for the younger community so they can enjoy the park and feel safe. Next is housing. We know that this is a big issue in the state of Utah right now. Housing costs, choice, accessibility. We know that Utah has prices have gone skyrocketed, and it's made it almost hard for people to stay there. But as I mentioned at the very first, older adults want to stay in their homes. But then we have problems with, well, if the older adults aren't leaving their homes, what about the younger generation? So this is a problem to have an age-friendly community that addresses these issues because we have resources about additional dwelling units, how to go back and home fit your home better so that a person can live there as they get older, and making room for making room. You know, uh, as we see these things going on in the state of Utah, we want to make it so that it's accessible for all ages, all incomes, and all abilities. Transportation is important because do you have accessibility to safe sidewalks? Do you have crossable streets going from one place to the other? Now, when we think of transportation, something of, oh, we got to have buses and places and things like that to move around. That's not always what it's intended with this particular domain, but we do have resources about the future of transportation and roadmaps of livability to add just to help think out of the box and to help with those types of issues within your community. Next is social participation. Unfortunately, loneliness is rising in the United States where it is affecting people's health and mental health. So we want to have a sense of meaning and belonging. What are we doing to help make sure that everybody can come together and enjoy their community, not just going to work, coming home, and staying isolated? We don't want those types of things to happen. So we have several resources that go with that that can help their community make sure that depression goes down, that their overall health is better, and anxiety goes down because they belong in that community. Respect and social inclusion, as it says here, everyone wants to feel valued. That is such a strong and important part of what we need to do. And we want a community where everybody feels valued. Too many times in my life, I've come across older adults that have felt like they're not even a person. They're treated less than that, and they feel like they're ignored, they're not listened to or understood, and they've just lost their self-worth and their self-being. And that's what we don't want. We want to make sure that they're feel valued and welcomed and offer that they can have, a place where they can go out and everybody's respected and enjoyed. It's just so important nowadays that we would have that. So we have some resources associated with that to help with these types of situations. Employment and civic engagement, as people are older adults, their ability to work and to pay for things, um, making sure that there's no type of um, bias against older adults, but that they're also volunteering within their community because when people retire, they still have a lot to offer and they have a lot of skills that they can offer. And having or holding a perception that one can make a difference on problems that exist in their community is a top predicator for 50 plus civil engagement. There are so many people out there who want to do things and want to help. Let's provide them an environment where they can come out and help, either through meaningful work or through volunteering and the skills that they had attached with their prior work history. Then we have communication and information, sharing those information about their community. 76% of adults 50 plus place a high importance on having access to reliable and affordable in-home high-speed internet. If you think about it, it wasn't too long ago that we didn't have high-speed internet, but how things are so important and how our houses are becoming more tech savvy, and with smartphones and internet, we need to make sure our communities have access to high speed internet, that they're also tech savvy too. We can have all the high speed internet that we want with an older community or an age friendly community, but unless they know how to use it, it's not being a very valuable asset. So we want to make sure that everyone has some type of tech training so they can be savvy for what's available in their community. Next is health and community services. Of course, we want to make sure that they have access to affordable health care, that they have the ability to maintain an independence and healthy independence. So what's in place? Do we have healthcare workers or healthcare services in that community to help provide that well-being through life? U.S. adults age 45 plus think that many healthcare issues are important. Staying mentally sharp, staying physically healthy, and having adequate insurance coverage. Does your community provide those types of services? Is it available? And then, of course, we have disaster preparedness, which is we always want to be prepared. We never know what's going to happen. We have earthquakes, wildfires, floods. We don't have very many hurricanes here in Utah, but if you never know, we've had a tornado a few times. Hey, if we have a hurricane here, it wouldn't be a shock, but you never know. We always have to prepare for disasters. And so that can be one of your plans is if you don't have a disaster plan in place, we can help with that. And we want to make sure that every area is prepared just in case. So what we do as part of this is we get together and you come to the age-friendly network. You want to do this needs assessment. You kind of go through and rank yourselves on your preparedness on a community scale of 1 to 10 of, how are you doing with these particular domains? And then from there, and that community needs assessment, you can help build a plan to help you become an age-friendly community. As I mentioned, AARP provides all the resources for these particular things. We have the newsletters, we have a map, we have a landing page with all the different resources. We have short videos that go and walk you through the process of applying, needs assessment, how to set the goals, all those different things. Like I said, you don't have to reinvent the wheel. We also have community challenge grants, which allow the communities to apply for grant money every year to do part of these changes with these domains. And then on aarps.org, we have lots of different publications, like I mentioned, and resources to help with that. So what I'll do now is I will stop sharing because this is the process of that. But we want to make sure that you can now see the fun part of it, which is Ryan sharing with you guys the process that it takes to go through this.
Thank you so much, Darren. I really appreciate that overview. I think it's a really exciting opportunity, a really exciting program. So I'm happy to be here today and share kind of what we've been working on. So here's my screen. I think everybody can see it now. So as Darren mentioned, Salt Lake County pursued the AARP Age-Friendly designation this year, with that officially coming through in May. And this has really been a partnership between two offices at Salt Lake County. One is the Salt Lake County Office of Regional Development, and that's where I am. And then we also work really closely with Salt Lake County Aging and Adult Services. For a little bit of background, Salt Lake County Office of Regional Development has 4 divisions. We have environmental sustainability, housing and community development, economic development, and regional planning and transportation. In planning and transportation, that's the division that I fall under, has been the project lead for this age-friendly communities program. Um, and it all really started with our regional solutions event that we held last year, which this is an event we hold every year or so where we bring planners from across the region to come learn about a pressing issue that our communities are facing. And last year we chose aging in place as our theme because we saw the need, the growing need with this demographic increasing over time, and thinking that we really need to plan for ways that we can meet the needs of the older adult community tomorrow in the future. So what are things that we can do now to lay the groundwork for communities that are more livable in the future for future generations of older adults as well? And we think this is a really great partnership with Aging and Adult Services because not only are they the largest area agency on aging in Utah, they're really focused on meeting the needs of today. So they have services like senior centers, caregiver support programs, healthy aging, home and community-based care, rides for wellness, Meals on Wheels, etc. And they're really now focused. They do a lot of future planning as well, but their work is really focused on the service delivery and program piece, and our work is more on the future structures of our communities, the roads, the housing, the uses, the walkability, how these things connect. And I think that this partnership really enables us to kind of see both sides of this issue and be more proactive in how we address aging moving forward. And it's already been mentioned, but Salt Lake County is aging rapidly. The older adult population in Salt Lake County increased by 50% from 2010 to 2020, and that trend is only expected to continue. So we anticipate that there's going to be more and more older adults, and we're really interested in, like I said, laying that groundwork to make sure that we are prepared for that future. We're a little bit lucky. Other communities across the country have already started to experience this really rapid aging, and we're in a unique position in Utah that we have been one of the youngest states, one of the youngest communities in the country. So we can really see this problem coming. So we have the opportunity to prepare now for that future. These are some of the initiatives that Salt Lake County is already doing. And I already talked about some of these, a couple other ones that I want to focus on. We have a housing trust fund where we, in the Office of Regional Development, recently put together a housing development project that has 300 affordable units for older adults. We also have a complete streets policy encouraging walkability and balancing the needs of all users of the roadway. We're working with KMC Gardner to put together a 10-year community needs assessment that should be released in the next few months. And that's really going to be focused on health and nutrition and housing. And Aging and Adult Services, as part of their regular work, already completes community needs assessments on a regular basis. And I put this here just to highlight that one of the reasons that we are really interested in pursuing this designation is because we know that Salt Lake County is already doing a lot of this work. And we think it's an important opportunity for us to be able to bring all of these kind of disparate programs or policies or projects together under one program, the Age-Friendly Salt Lake County program, so that we can, one, highlight to the other communities the work that we're already doing, community leaders the work that we're doing, but also too so that we can start sharing this information with the residents that could really use it. So sometimes there might be a program that we're doing that is benefiting older adults, but we don't really see that, and older adults are having a hard time connecting to it. So if we can find a way to house everything in one place, it'll make that a lot more accessible. I also want to talk about some of the benefits that we see in joining the network. I recognize that there might be some community leaders on this call or staff members that are interested in convincing their community leaders to join the Age-Friendly Communities program. So I wanted to talk about some of these different benefits that we see. So first is recognition, then I'll talk about resources, and then lastly I'll talk about this building momentum. So recognition, these are just some headlines from communities all across the country. I did put 2 of ours in there because, like I mentioned, we became an age-friendly community in May. So that was really exciting for us to get some of that kind of just earned media around this issue. And it's important that your community gets highlighted. We want people to feel like the community is really taking care of them and cares about these issues. One of the things Darren mentioned is that a lot of older adults feel left out, they feel ignored. And so we see this as an opportunity to show older adults in our community that we are committed to making the community more livable for people of all ages. Next is this wonderful library of member resources. Darren mentioned this already, but there's like access to expert level technical assistance and educational materials, best practices, policies, current research, community engagement strategies, etc., are all available in this kind of members only platform that once you join the network, you're able to get a login and access all of these resources. Examples we've used include community and departmental survey templates, resource webinars, and data sharing. So there's just a lot of really great resources in here. And on top of that, you get connected with this network of almost 1,000 age-friendly communities. So if there's something that we're struggling with, we can just go on here and start our own discussion and have our own conversation and develop our own relationships with these communities and see maybe this one community isn't quite exactly what we're looking for, but another community we have a lot in common with, and we can connect on that common ground and find opportunities to build off of the work that's already been done and not reinvent the wheel. As most of you probably know, a lot of capacity is low for this type of work. We don't have nearly enough funding or staff to be able to do everything that we need to be able to do. So taking advantage of resources like this is really a great way to move forward. And then last, I'm going to talk about the momentum for the different benefits. As I mentioned, we had our Aging in Place Regional Solutions event last year. Our keynote speaker for that event was Danielle Aragoni, author of Climate Resilience for an Aging Nation, a really wonderful book talking about disaster mitigation and disaster relief and how that relates to climate change and also older adults throughout the country. Also, as many of you know, the governor has his WISE initiative. The state just put out this master plan for aging, the Utah Commission on Aging. I mentioned the Kempsey Gardner Policy Institute's research that they're working on right now for us. And then also the Utah Foundation has been undergoing an incredible effort looking at the general plans of communities across the state to see how they plan for aging in their general plans. And actually, they just had an amazing panel this morning where we got to learn more about mobility and transportation and how that connects to this work. So there's a lot of momentum in this space. I think it feels good to be able to be part of something that's growing. This issue has been front of mind for a lot of people for a long time. Aging and Adult Services has been pushing this work for forever. And now it's really great to see the popularity of this issue rise. And it's important that we take advantage of that momentum and join the movement as it's growing so that we can take advantage of all of the opportunities that come with that. So here's our timeline. So we actually condensed our timeline to 4 years instead of 5 years. And the goal of that was to align it with the Salt Lake County Mayor's term, because we think it's really important that elected officials and community leaders have ownership over this project. So that's something that you might want to consider as you're putting together your proposal for your community, is seeing what timeline makes the most sense to you. AARP is really flexible and will work with you on putting together something that works best for you. And in addition to our designation, we actually collaborated between the mayor's office and Salt Lake County Council to put together Older Utahns Month proclamation, designating May as Older Utahns Month in Salt Lake County. So we did these two pieces at the same time, so that way we were able to really build consensus and bring all of the leadership of Salt Lake County on board at the same time, and make it feel like it really is a commitment from all of Salt Lake County to support older adults. And then briefly, just our next steps. So right now we're working with other county staff to develop an inventory of age-friendly programs and services. Like I mentioned earlier, a lot of times there might be a program or service that supports older adults, but older adults don't know how to access it or might not even know that it exists. So we want to make sure that we have an inventory of everything that Salt Lake County is currently doing, and that will identify potential gaps or maybe even opportunities for maybe a small tweak to a program that's already running and existing, that with maybe one small change can become more accessible to older adults. And then at the end of this year, we'll be finishing our community trends report. So that's kind of looking at what we expect the needs to be. We already have our community needs assessment complete for this year because of, like I mentioned, Salt Lake County Aging and Adult Services, as an area agency on aging, has already completed a community needs assessment. So we'll be using that for our community needs assessment this year, and then looking at that to identify what we anticipate future needs might be, and what these maybe trends could be. And the community trends report, the community needs assessment, and this kind of inventory of age-friendly programs and services will all be used to inform our action plan for next year. And that is all I have. So I will stop sharing. And if you have any questions, you can feel free to put them in the chat, or I don't know, maybe we'll want to have some people ask the questions if you have any. Yeah, thank you, everybody.
All right, great. A big thank you to Darren and Ryan both. I think we can all agree that we've received a wealth of information, and we'll be sure to send out all of the links and resources for those who want to do a deeper dive. I do recognize that this webinar was originally scheduled to end at 12:30, so if you need to hop off, please feel welcome to do so. But that said, I do think we have an opportunity. Darren and Ryan, if you're willing to take some questions, we'll just open it up, and feel free to either come off of mute or go ahead and drop your question in the chat. All right, let's see. I'm not seeing any questions so far. We'll give it about 10 seconds more. So if you have a burning question, here's your opportunity. Okay, great. Well, all I'm seeing is a lot of big thank yous and acknowledgements that it was a great presentation. We do have a couple questions actually that just came in. So one of the questions is, what are the best ways for sending the information out to seniors?
Yeah, I think that's a great question. I think that's something that we're trying to answer right now for ourselves, to figure out where are older adults getting information that they trust, and identifying those opportunities to get this information out. A lot of times information is provided through AARP or through the Senior Center program. We also, I believe Aging and Adult Services works with healthcare providers for referral programs, UTA. We're working on figuring out exactly what this network of communications looks like, so we can figure out what's the most effective. And Darren, you might have more to add there as well.
You know, and you brought up a lot of great responses for that, and that might be one of the domains that you want to look into, is because there are set ways of providing communications to older adults in your area, and that might not be working. That might need to be that community assessment plan and survey. Where are those older adults getting their information from now? And how do we piggytail or get on that train to help get that information out? Because there's so many different ways of providing information and so many ways that it's all muddled. So there's not one best way of doing it because each community and each city is different. So like a rural one might be the local radio or the newspaper, where here it might just be social media or a particular like KSL or a particular news channel that they listen to. So it's really hard, and it really has to you have to kind of take a step back and kind of figure out where the majority of that's coming from. And that's hard. Just like Ryan mentioned here in Salt Lake County, she's got a lot of things with senior centers and buses and all that stuff, but what works? And they're still trying to figure that out too, just as much as AARP is.
Great, thank you both. Another question is curious what the main barriers are for more communities applying for the designation.
Would you like to go ahead, Ryan, since you just did this?
Yeah, I can share a little bit. I know that for example, there was an initiative a few years ago for Salt Lake County to consider joining the AARP program, and it kind of fell, and it never was completed. And what I've heard about that was that the focus of the mayor at the time shifted to homelessness services, and so kind of the focus pivoted. And I think a lot of times people are kind of maybe at capacity, the staff, and they're waiting on leadership to provide that guidance. Hey, this is something we really care about. Can you look into this and pursue this? And I think that maybe we need more staff to kind of take that initiative and bring it to leadership. So that's something that I did just as a follow up to this event that we did last year. That we do this event all the time. This is part of our regular work. And then we were started having conversations with all these different partners and stakeholders, and I realized that it's an opportunity to build upon this and kind of formalize this relationship that we've started developing, even just internally between the Office of Regional Development and Aging and Adult Services. So I think a lot of it is capacity knowledge that this program exists. I think that maybe a lot of community leaders aren't aware that the program exists, and don't really know what those benefits would be. I know that a lot of times community leaders are also can be a little shy about committing themselves to such a large undertaking, want to be cautious about the promises they're making to their constituency. And so I think that that could also be a barrier. So recognizing that this is not like we're not age friendly all of a sudden. Salt Lake County, we didn't receive this designation because we submitted all of this information proving everything that we're already done, and we got the box checked that we are age friendly. This is really a commitment to continuously improving and working on this issue. And I think using that messaging can help sell some elected officials that might be a little more concerned about over promising or over committing themselves.
That was a good response. And I would just add that if they have a champion within that community, it doesn't have to be the elected official, but somebody that can help lead and champion that cause of age friendliness and having that designation to help see it from the beginning to the end is always important because as was mentioned, things change over time and people's views and what's a high priority within that community might change over time. But if you have that champion in place to help lead the charge and help get that designation at the same time improving that community to where the elected officials are being received as the great leaders as they are in your area for helping provide that. I think that one champion or a couple champions within your community can help get that process moving and started.
Great, thank you for those answers. We also had another question come through. can you talk more? Sorry, one second. Can you talk more about your strategic public outreach and education plan?
That question for me or Darren?
I guess it could be for both.
For both of us. I'll start. I will be honest, we and since we started the age-friendly communities program, haven't undertaken a strategic public and reach or education. We're really relying heavily on the work that's already been done by Aging and Adult Services. So, as part of being an area agency on aging, they complete community needs assessments and do pretty rigorous stakeholder engagement. So I know they've done surveys and focus groups and really tried to. They did phone surveys calling older adults across the county. Like they're really focusing on that engagement piece for those community needs assessments. And I'm not so familiar on the back end of that since it was completed before my time.
So AARP has materials and has information that you can share with your public and provide outreach and education of what an age-friendly community is, the different domains, what types of things you can do to start that conversation with the community, or you can use the information and resources with the age-friendly network to talk about things as you're progressing along that path. So, enrollment is the first part, but the education about what you're doing attached with the community needs assessment, which, as Ryan mentioned, could be helped with your local aging and adult services program. That strategic outreach and education, you don't have to invent it. There's lots of different things that are currently in place within the age-friendly network that you can use to use education. I've seen stuff from like basic layouts to how to do a presentation, how to set up booths, how to set up an actual event and talk about these different domains. So you don't have to, like we mentioned, reinvent the wheel. There is stuff in place that you can use from AARP to help do that type of public outreach and education.
Thanks, Darren. And I'll add a little bit on the jog some things for me. We were actually originally planning on doing a new community needs assessment using the survey tools from AARP. So we took a look at that, adapted the questions that they had, and were thinking about distribution, and then thought about the fact that we had already kind of done this a couple years ago in a much more robust way than I was going to be able to do by myself, or with the help of our intern Natasha this year. So we decided to use the existing information and actually refocus the additional kind of engagement that we're doing internally, because we really wanted to narrow down what is the county's role in this. As a county form of government as opposed to a city, we have a very different set of functions than a lot of municipalities. So we wanted to learn more about what the county is doing, how the county can update our operations and our programs that we're running. And so, and AARP actually also had a tool that we were able to use that was a kind of internal survey that they had developed also. So not just an external facing one, but one for department heads, directors, etc. So we're able to take that and convert it into an interview format, and we'll be starting those interviews actually tomorrow.
Great, thank you. And so far, it looks like that's the end of the questions that have come through the chat. Does anyone have any other questions that you want to ask? Okay. All right, well, seeing none, we will go ahead and wrap up. Just a big thank you again, both of you, Darren and Ryan, for the information that you shared today. For those who attended, we will be sending out the follow-up email shortly. And I'm also going to drop the link to just a quick 2-minute survey that would ask that you complete, just letting us know what you found helpful in this webinar, in this webinar, and what you might be interested in as future webinar topics. So thank you, everyone, and hope you have a great rest of your day.